antigen testing, which I know you're in favour of generally, and we know that Professor Ferguson's recommendation was to use it. And then you have Professor Nolan referring to it more or less as snake oil. And then there was a letter from Dr. Holohan to you saying, beware of antigen testing. I mean, this is crazy stuff. We're out of line with pretty much every other country in the developed world.
As you know, I know you're a very big supporter of this, and I'm a supporter of rapid testing. It's why I brought the expert group together, set it up. It's why I endorsed and published the report, the Ferguson report. The reality is there are very credible people, not just in Ireland, but right across the world, on both sides of this argument. The Ferguson report, it actually is an example of this. It wasn't a unanimous report. It was a majority report. There were two members of the team.
The people from government side, the HSE and NPHET, who were the only objectors. The independent thinkers who didn't have, if you like, direct skin, professional skin in the game, they all said, yes, it's appropriate. Let's go do it.
Well, first of all, my view is that this is not because of people having direct skin in the game or not. Everyone who's involved, be they on NPHET or be they on the Ferguson group, everyone involved is trying to do the right thing for the country. They're looking at the data and they're coming to what they believe are the best conclusions. But, I was reading this morning, there's a UK group, Pat, called the Cochrane Group. I know you've looked at their stuff before, and their latest report is interesting and it's quite nuanced. And what it says is where you have a high prevalence of the disease and you're testing symptomatic people, or to some extent non-symptomatic people, it's very, very beneficial. Interestingly, though, they say that when you get to low prevalence and non-symptomatic people, you really have to carefully weigh up the risks and the benefits. And the real concern that Dr. Holohan has and that people on NPHET have, and it is a legitimate concern, is that people get these tests, they may not be the right tests, they may not use them in the right way, and they may take a different meaning from a negative result and therefore act in riskier ways that put themselves and other people at risk.
But do you not remember that Dr. Holohan, at the time of the advocating of masks, he said the same thing. He didn't trust ordinary people to wear masks properly, that they would stuff them in their pockets, they'd infect themselves and all the rest of it. And then, of course, in time, mask wearing became the norm. Not that everyone wore them perfectly. But that wasn't the point. It was trying to use another tool in the armoury, and the same is true of antigen testing. Not everyone will do them correctly. But if you get a lot of people doing them correctly and saying, I'm not going to work, I'm not going into school because this test shows I'm infectious, that's a win.
It is. But doing it correctly is much more difficult than wearing a mask. So, for example, that same Cochrane report I was just telling you about, they looked at a very wide variety of tests. And interestingly, they found that when you follow the manufacturer's instructions of all of the rapid tests they looked at, they said the total number that met the minimum required sensitivity and specificity requirements was one single test. Right. So this isn't like putting on a mask. There's a lot of serious work has to be done to make sure that people are using the right test in the right way. And then what we've got to do is really get the message out there that if you're using the right test in the right way, and if you get a positive result, you should go and get a PCR test. If you get a negative result,
that is the advice.
Yeah, but
here's the advice.
It is, but the next bit is just as important, which is if you get a negative result, you should pretty much ignore it. It doesn't mean you're negative. The best tests used in the best ways are about 50% accurate. Some of them are as low as 3 or 4% accurate. And that's the key. The real fear that people have
Stephen,
is...
this is bad. This is propaganda. This is not fact. I mean, the science indicates that properly used antigen testing reveals when people are infectious. I mean, that is the science. And now you're telling me that only one test works. And that,
No, let me be clear. I'm not a scientist. I'm not an expert in this stuff. What I'm saying to you is that the Cochrane report, which is a well-regarded review, they found that only one single test, when you follow the manufacturer's instructions, met the minimum stipulated sensitivity and specificity, and that there is a wide variety of sensitivity, which is the positives, and some of the pilots have shown accuracy of about 3%, but others have shown accuracy in excess of 50%. The point being, Pat, if you get one of these tests and you get a negative, it doesn't mean you're negative. That's the most important thing to take away.
It means, if it's done properly, it means you're not infectious at that moment. And that's all the claim that has ever been made.
No, sorry, it doesn't.
For the antigen test.
This is where we need to be clear. If you get a rapid test, you go to Lidl and you buy one of those tests and you get a negative result out of it, it absolutely does not mean that you are not infected.
Well, you're actually saying, no, Stephen, you're actually saying it's pointless. There's no point in buying you're in favour of them, but there's no point in doing them. That, people cannot be trusted to do it properly. And even if they are trusted to do it properly, but it's probably wrong. That's what you're saying. You cannot have it both ways, that you're in favour of them and then you disparage them.
Well, let me tell you why I think you can. I'm not disparaging them, Pat. What I'm saying is
they're useless by your last commentary. They are useless, which is not what the international experience is.
And it's not what I'm saying at all. What I'm saying is, if you get a negative result, under no circumstances does that mean that you are not infectious. And please don't behave as if you have a result that says you're not infectious. It's really important. I think they are useful because of the positive tests. So the best tests have an accuracy in terms of true positive of about 99.9%. So chances are, if you test positive, chances are you are positive and you should go and get a PCR test. And critically, to your point on infectiousness, and this is a point Professor Ferguson keeps making, if you test, what these things are really good at is testing when you are both positive and infectious. And therefore, even though you may pick up a very, very small number of people in the population, you're picking up the people who are infectious. And hopefully, if they then go and isolate themselves and get a PCR test, you are stopping some of these super spreader events. And that's why I support them. It's why I set up the expert group, and it's why I support the findings from Professor Ferguson and the team.